Social Security or Medicare or Medicaid benefits they earned. And so we're going to talk about that. There are just 20,000 pages for Social Security alone. Social Security policy is over 20,000 pages and it's difficult. Social Security is understaffed, worse than 50 years, and they're not able to help you. Their job is to help you get your benefits, all the benefits you earn, paying FICA all those years. But unfortunately, because the offices are so short staffed, they're not able to help you put together the pieces of the puzzle. So people go down there and they say, "Well, I want retirement or I want spouse benefits or I want Medicare." And that's what you get. You go down there and you get what you ask for. The problem is a lot of people don't know that they're supposed to ask other questions, and the Social Security employees are so inundated, they're so understaffed, they're not able to go through everything, and so people are missing pieces of the puzzle. So in my semi-retirement here, that's exactly what I'm doing. I'm helping you all make sure you get everything you earned from all things Social Security, retirement, disability, spouse benefits, survivor benefits, Medicare, Medicaid. If you're new to my channel, this is how it works. I talk about the topic of the day, and that's what's the topic of the day, the missing pieces of the puzzle. I'll do that for about 10 or 15 minutes, and then I'm going to open it up to questions. So I already see some questions there. So anything you have, make sure you type it in the questions there. If you're watching on a recording later, make sure you subscribe so you can catch us next time. Okay. All right. And one of the most important things about all these videos we do here is that we've got, I would argue, the best community on the internet in social media because got close to 250,000 subscribers. And if you watch my lives on a regular basis, you know that people come in and says, "Hey, I found this lady down the street that needs help. My brother, my cousin, this lady at the restaurant needs help." So this is a community. So if you listen to this and say, "Wow, that was a complete waste of my 10 or 15 minutes of time," good. That means you're getting everything you earn. So that's a beautiful thing. However, I know there's people around you that need help. So take that information and go out there and be a superhero. All right. So you go in there and file for retirement benefits. Great, awesome. You know, whether you're going to do early retirement or full retirement age or delayed retirement, you get your voluntary delayed retirement credits, all that kind of stuff. I've talked about that in several videos. I'm not going to talk about that today in this context. But people get their retirement benefits and they forget they can also get spouse benefits. You can't do it like you used to be able to do it a few years ago, where you could get one benefit and then stop it so your spouse can get benefits. That stopped in 2016. But if you're currently receiving retirement benefits and you're currently married, you'd be surprised how many people are currently married and don't realize their spouse benefits from their current spouse. It's amazing. Anyway, but you can also get benefits from a divorced spouse. As long as you were married to that person for 10 years, there's a couple exceptions there. An independently entitled divorce spouse. Here's one that's probably being missed. Probably the top five are being missed. It's people are sitting around twiddling their thumbs, waiting for their ex-spouse to file for benefits because they think they have to wait. And unfortunately, Social Security, a lot of Social Security employees don't know this, which is pretty pathetic if you ask me. My office, I had about 100 employees and everybody knew about this particular program. So it's independently entitled divorced spouse benefits. If you were married to someone for at least 10 years, you've been divorced for 2 years, as long as that person is 62 years old, whether they're collecting benefits or not, no relevance whatsoever. If they're 62 and you're starting your benefits on your own record, then you can collect those benefits on that person's record. You don't have to sit around and wait for them to file for benefits. Another thing that a lot of people are missed, if you're on disability, they think, well, because I'm on disability, I can't get spouse benefits or survivor benefits or independently entitled divorce spouse benefits or anything like that. Or I think I can, I think there's more money there, but if I'm 62, 63 years old, and if I switch to that, I'm going to lose my Medicare because I'll have to wait till I'm 65 on Medicare. Because you're on disability, you have Medicare through your disability. Medicare starts when you're on disability after being on disability for 24 months. So people say, yeah, there's a few hundred extra dollars on spouse benefits or surviving spouse benefits, but I don't want that because I'll lose my Medicare. No, incorrect. You can keep your disability and collect spouse benefits, surviving spouse benefits, independently entitled divorce spouse benefits. And because you're continuing your disability and you're just adding those extra benefits on top of there, there's an offset on the calculations, but you're just adding extra benefits on top of your disability. And because your disability still continues, your Medicare still continues. So please, I know there's way, way too many people out there that are struggling and need that extra money. Here's a big, a lot of moving parts here. If you're on Medicare after 24 months of being on disability or you reach 65, then if you're low income, low resource, you can go through the state and Department of Social Services, Department of Welfare, Medicaid office in your particular state. You apply for Medicaid. And if you get the higher levels of Medicaid, you can get what's called a Medicare Savings Program, because a lot of people are having a difficulty paying the $185. Part B for 2025 is going to be $185. A lot of people are having difficulty paying that. So if they go down to the local Medicaid office, then if they're approved, the state will pay for their $185. And then the next piece of the puzzle, that's called the Medicare Savings Program, MSP. And if you get that, it depends on your Medicaid level again. You can also get what's called a Medicare Advantage dual eligible plan. If you watch my channel, if you're regular viewers, you know that I always recommend Medicare supplements first. Anytime you're new to Medicare, 65, just stopping working or something, you're new to Medicare, please, please, please check out Medicare supplements first, the plan N and the plan G. And then if it's not right for you, then check out a Medicare Advantage. But don't let anybody try to get you to enroll in a Medicare Advantage first. There's a lot of people out there that are not doing the right thing. That's why I partnered up with Chapter Medicare, and they can help you out. So if you're turning 65, and then there's another enrollment period coming up here pretty soon, but I'll talk about that in a little bit. What about the LIS? Oh, speaking of the dual plans, so Medicare Advantage dual eligible plans, those are the ones you also see that are predominantly tied to those kind of those those grocery cards, the food cards, the over-the-counter drug cards. Those do exist. Those do exist. But the way they're advertised in social media is very, very scammy. They take the best one in the country and they advertise it to the entire country. And then you call them up and they say, well, you don't live in, southwestern Utah, so we can't get it to you. But, so then they do the hard sell. So it's kind of scammy. So, make sure you watch out on that. And Chapter Medicare, reach out to them and they'll help you out and see what's available in your particular neck of the woods. What about LIS? That's called low income subsidy. It's also called the extra help with your Medicare prescription drugs. So if you know someone having a difficulty paying for their prescription drugs, make sure you tell them to file. They file for that through Social Security. I've taken hundreds of thousands of those applications. It's one of the easiest applications in Social Security. So definitely check out for that. Another thing, if you're filing for retirement benefits, early retirement, 62, 63, whatever, and then you say, well, I wanted to keep working, but I'm just not able to work anymore because of my disability. I have a limitation. Well, maybe you should think about filing for retirement benefits and disability benefits, as RIB is retirement insurance benefits and DIB is disability insurance benefits. So why would you file for both at the same time? You can't get both. You'll get the higher the benefit, whatever it is. But you file for both because if when you file for disability, unfortunately, right now, it takes 6 to 9 months if you're lucky to get a decision. And some people just can't, wait for 6 to 9 months with no income. So the trick is to go ahead and file for retirement benefits. You get your benefits coming in while you're waiting for your disability to be approved. So it's called a RIB DIB. You can do both of those. But kind of a warning, if you did get approved for disability, it really depends on how far they go back and determine your disability, but you might be reduced a little bit because you took, 1 or 2 or 3 or 4 or 5 months of retirement benefits. But it's called a RIB DIB. What about children? A lot of people are missing children. I mean, not literally, milk carton type missing children, but in terms of when they're receiving retirement benefits or survivor benefits or disability benefits, children, if they're under the age of 18 or became disabled before the age of 22, they can get benefits. If the parent is still alive out there and kicking, then the child can get up to 50%. If it's a surviving child, gets up to 75%. What is CIC? Child in care. This is another one a lot of people are missing. Child in care benefits. If you're the other spouse taking care of that child under the age of 16, not 18, but 16 years old, or that child became disabled before the age of 22 and you're essentially home taking care of them, you can get what's called child and care benefits. You can get up to 50% of the worker's benefit amount, or 75% if the parent passed away. All right, WIB to RIB. This is widow's benefits, widow's insurance benefits to retirement insurance benefits. If you're receiving widow's benefits, widower benefits, surviving spouse benefits, pretty much the same thing. And you turn 68, 69, 70 years old, maybe your benefits on your own record have increased more than your surviving spouse benefits. So your local Social Security office is supposed to send you a letter that says, "Hey, you get more benefits if you go ahead and file for retirement on your own." But some people move and they don't get the email, or the local office doesn't send it out correctly. My office always sent those out. But anyway, but yeah, if you're past your full retirement age and you're receiving survivor benefits alone, call up Social Security and say, "Hey, how much if I switch to my own?" And then the next question you should ask is, how much if I wait till next year? And they'll tell you, and then you can figure out what you want to do. Um, Same type of thing when you're on disability insurance benefits. Once you hit your full retirement age, 66, 66 and 8 months, 67, or whatever the case may be, you're no longer on disability benefits. They switch you from disability benefits to regular retirement benefits. And most people don't even know the switch, because your check stays the same, direct deposit stays the same, but you're free in two respects. You no longer have work limitations, and you no longer have those crazy CDRs, the continuing disability reviews. You're completely free. All right, here's the last one, and then we'll jump into some questions. SSI. This is another program that Social Security administers, celebrating its 50th anniversary at Social Security. Took it over in the early 1970s. It's supplemental security income. That's the welfare based. It's low income, low resources. How can you get that? Is through disability, being disabled, or aged. And Social Security determines age, defines aged as 65 and older. So if you know someone that has a very low benefit amount from Social Security because they didn't work very much, or spouse benefits weren't very much, whatever the case may be, if for next year the max is $967. So if you know anybody that's getting less than $967, have them reach out to Social Security and find out if they're eligible for SSI disability or SSI aged after 65 years old. Okay, let's jump into some questions. I've got some questions I've got on the YouTube comments, based on some previous videos I did. A viewer asked about the new nominations for the head of Medicare, Dr. Oz, and the new one that just announced, a Social Security commissioner. What's going to be the future of Social Security and Medicare with those two individuals? Well, Dr. Oz has made no secret that he really supports Medicare Advantage for all, and um, not sure about that. It really depends on the particular details. I'm not a big fan of Medicare Advantage plans. I like Medicare supplement plans, but if you can't get a Medicare supplement, or you can't afford a Medicare supplement, again, make sure you look at the long term when you're talking about can't afford it, then Medicare Advantage is far, far better than just having Medicare, Part A and Part B alone, because you've got so many, financial gaps and so many risks there. But on both of those, they've made some statements, but as all politicians, they make statements, and then when it comes election day, or when it comes inauguration day, then everything all of a sudden changes. So I'm going to keep an eye on both of those individuals and the new administration, and anything I see coming up, I'm going to make sure I make a video about it and let you all know, give you heads up so you can reach out to your politicians and give them a piece of your mind. Another thing about Social Security, Medicare on the table. There's some politicians that have come out of some closed room negotiations, and they say, yeah, everything is on the table, including Social Security and Medicare. But we were told that it wasn't going to be on the table. So I'm going to keep an eye on that. The issue is, we've been kicking this can down the road way, way, way too long. We should have solved the Social Security issue in terms of the trust fund and everything decades ago. but we kept kicking the can down the road and we didn't press our politicians or they didn't want to. They ignore the problem to delay it. And then they distract with, the trust fund was stolen, which is completely incorrect. I've done several videos on that. We're giving the Social Security money to these other people, these other countries, which is incorrect. These are all distractions, and we need to stop that, have a serious conversation about it. So they ignore and then they distract. So then they can come in when it's a crisis and cut benefits or kill the program or gift it to their Wall Street buddies so they can get a bunch of kickbacks when they get out of Congress. So anyway, but I'm going to keep an eye on all that. All right. Another question I have is about enrollment periods. We just finished the annual enrollment period for Medicare, and people are saying, "Oh no, I missed the date. It was December 7th is the last day I could have changed my Medicare Advantage or switched to back to a Medicare supplement or a Part D plan or whatever the case may be. What can I do? I missed the date." Well, there it really depends. You have a special enrollment period. If you move, there are special enrollment periods to switch plans. January 1st, there's another open enrollment period that goes January, February, March. It's a very limited one. You can start considering those options now. Again, reach out to your insurance broker, agent, someone you trust, or you can reach out to Chapter and they can help you out and just say, "Hey, I missed my date, or I'm moving, or I'm turning 65, or I just, lost my health insurance from work," and they can find a plan for you: Medicare Supplement, NG, Medicare Advantage, Part D plan, and all the rest of it. So they will help you out, and their help is always 100% free. All right, let's jump into some questions. Um, Once again, please explain how we can benefit from applying to the extra help plan, and how do we do that? Yeah. All right. So the extra help with prescription drugs, also called the low income subsidy, super, super easy form. It's for people for low income, low resources to help with prescription drugs. And as of pretty much this year, last year, it's estimated that people save up to $5,700 a year if they get into this program. Next year is going to be different because next year, this is one of the reasons the whole Medicare season this year was the craziest it's been in decades, is because of all the changes to the prescription drug plans and everything, including Medicare Advantage, because most Medicare Advantage plans have prescription drug plans built into them. So that's why there was so much craziness for next year. There still is. But part of that is Part D. Now there's a cap on how much you can pay out of pocket for your prescription drugs. This year it's like $8,000. Next year it's going to be $2,000. So that's why the Medicare insurance companies are kind of going out there and canceling people and everything. So the prescription drug program is going to help, but not as much as it used to. But people are still going to get help. And there's another thing. So you can apply for Social Security. You can go online. You can call the 800 number. Super, super, super easy application and just apply. Shouldn't take very long. And they'll check to see if you're eligible. And then there's another program for next year. It's called smoothing. So if you have an expensive medication, say it's a couple $1,000s a month, you'll pay $2,000 in January and you're done for the rest of the year. But you're like, but I still have to pay $2,000 in January. Well, you call up your Medicare Advantage plan or your Part D plan and you say, "Smooth me." And basically they set you up with a kind of a payment plan throughout the year. So instead of $2,000 one month, you pay $2,000 over a 12-month period. So that's a brand new thing that comes out next year. Help. Am 68, prior Social Security disability. Thought you get X survivor benefits retro 2 years because prior inquiry. Can Social Security backdate on X and save my record? Concerned Social Security cut survivor benefits. Need delay draw my record. Okay, wow, a lot of codes there. Okay, so you're 68 years old. You used to be on Social Security disability. You're on regular retirement benefits now. You filed for survivor benefits, but they only started your survivor benefits when they started it. And you're arguing that, "Hey, I contacted you guys 2 years ago and asked about survivor benefits, so you have what's called a protective filing potentially." So they did not close the lead, as we used to call it internally. Well, they still call it internally, but anyway, I'm not with Social Security anymore. But they did not close the lead appropriately, or they sent you a closeout letter, or they didn't send you a closeout letter. That's the issue. So what you can do if you want those 2 years of retroactive back pay then you file an SSA 561. This is the government. There's always a form, right? So an SSA 561, and you say, hey, I should get 2 years of back pay because I called you on, August 18th of 2022 or whenever. And, I asked you about survivor benefits, but the person told me incorrectly or whatever the case may be. But remember, if you're looking, you're looking at these before your full retirement age, then your benefits, those are going to be reduced. Anytime you take money early before your full retirement age, you're reduced. But you're 68 now, so in your particular case, your benefits might not be reduced on a monthly basis. So, can you receive state disability benefits and Social Security benefits at the same time? Yes, absolutely. Um, but if those state disability, if this is a workers' comp or public disability benefit, then that money will offset what you're receiving from Social Security. Congress many years ago decided, hey, people shouldn't make more when they're on disability when they actually worked. So that's why there's that offset there. But yes, but if it's just a regular pension, a disability pension from a work or something like that, and long-term disability from work or something, that's not an issue. But if it's a state type of thing, you can receive both, but one offsets the other. Does Medicaid confiscate money if a person is a life insurance beneficiary or say a person wins $100,000 lottery? Does Medicaid take those funds? Not necessarily. They don't take those funds necessarily. It depends on your state. And if you tell them immediately, hey, I just got $100,000 yesterday, then you call them up and they stop your Medicaid because Medicaid is a, low income, low resource. So if you got $100,000 sitting around there, then they'll stop your benefits immediately. But if you didn't tell them until 6 months later or something, then they could very well go back and say, hey, you should have told us 6 months ago. You weren't entitled to the Medicaid benefits 6 months ago, and you went to the doctor that time, that time, that time. We paid $20,000 for that. You owe us $20,000. So, yes. I missed this yesterday. What can we expect from Bisignano, like privatization? Yeah, so he is the new Social Security commissioner, and I don't know. Politicians and these type of guys make statements and then they, change the next day. But he is a Wall Street type guy. We haven't had a Wall Street type guy as the commissioner of Social Security, and this is the long-term play of those people that want to destroy Social Security, get rid of it, want to privatize it, is to create the crisis, distract y'all by saying, hey, the funds are stolen. The funds are given to Ukraine. They're given to illegals. That's all the distraction. And we keep falling for it. Um, and then, it becomes kind of a self-fulfilling prophecy. And then they said, hey, well, we've tried nothing and we're all out of ideas. So I guess the only thing we can do is, cut benefits or, give it over to Wall Street. And to have someone from Wall Street being the head, that might not portend well for the future of Social Security. But to be fair, this guy is also, when he was working for some of these JP Morgan Chase and Citibank and all these companies, he was also kind of, I guess, an efficiency operational type of guy. So if he uses that part of his, Dr. Heckle, Dr. Jekyll, Mr. Hyde, yeah, type of thing, then if he uses that part of his personality, his background, then yeah, that's beautiful. Yeah, Social Security efficiency, absolutely, 100%. I could, give me a call, Frank, and I can tell you how to save a few $100 billion. So I don't know about a few hundred billion, but a good billion or so. We'll hire more help. The government has a lot of money. They give it to the other countries. This country is so sad. Yeah, that's why don't they fund Social Security? If you watch, there was a congressional hearing a few weeks ago, and you can tell immediately the politicians that don't want to help is they will distract. They will say, "Hey, how come you guys are teleworking? How come there's not cars? How come I know this guy that knew this guy that had a sister that had a cousin whose neighbor, was getting disability and they weren't supposed to." And so they distract um, and basically they're just kicking the can down the road, and so they're not helping. And those are benefit cuts happening right now. We've got cuts coming in the future, either 2033 or 2031. But cuts are happening right now because people are not getting the benefits they earned. And those are essentially cuts. And your politicians are not funding offices to help you. So call your politicians and say, okay, forget about the rest of the country. What are you doing? What are you doing, local senator and local, congressperson? There is a Social Security office right down the street from your office. What are you doing to improve the customer service? How come we have to wait 3 hours on the phone to talk to those people? Why can't we get an appointment next week rather than 2 months from now? Why? Forget about all the other 49 states. What about your district? Do something about that. And if we all did that, then we'd all get the help we needed, and y'all would never see me again. So I might just do another crazy YouTube channel about something else stupid anyway. But anyway, I turned 64 in August. I've been on disability for about 6 years. Am also eligible to apply for retirement while I possibly receiving less. Yes, if you stop your disability benefits and switch to retirement, yes, you will receive less because you're going to be filing early. So people ask this all the time. No, you're getting basically your full benefit amount, your full retirement amount. If you're 55 years old, you're getting what you would get at your full retirement age. So no, yeah, nobody pretty much switches to regular retirement when they're on disability. However, you are, as I mentioned, switched from disability to regular retirement once you hit your full retirement age. But that's just more of a bureaucratic thing. They stop taking your money out of the Social Security Disability Trust Fund, and they start taking out of the Social Security Retirement Trust Fund. So, also, can programs be shut off like a light switch, or does it take a congressional or judicial act? Yes, it takes Congress to make the laws to say, okay, from now on, we're going to change the laws. And, if you want your Social Security benefits, you're going to have to go to, JP Morgan or, they've already done it with Medicare. So Medicare Advantage is privatized Medicare. So when you sign up for a Medicare Advantage, you're essentially giving up original Medicare and you're saying, hey, I'm going to have this private company, dictate what kind of help I'm going to get. So that's, Social Security Advantage instead of, so, but Congress would have to do it. I'm 60. There's a lot more of that. I just don't want to get on there. Let me answer more questions. I'm 66, still working. Spouse is working as well. He's collecting Social Security. I'm ready to sign up now. Do I need to do my own registration first before I can collect spousal benefits? Yes, absolutely. That change that was that 2016 change I was talking about. So yes, you have to file for benefits on your own record first, and then if your spouse's benefits, the full benefit amount is twice your full benefit amount, then you can get some extra benefits on that person's record. Um, so you have to file for benefits on your own record first in order to get spouse benefits, divorced spouse benefits, independently entitled divorced spouse benefits, but not survivor benefits. For survivor benefits, you can get survivor benefits and not start your own. So you can go ahead and get survivor benefits and don't touch your own and let your own increase until you hit your full retirement age or 70 years old. So I am 53. Husband passed 2 months ago on disability. Wow, sorry. 50 years old. Wow, that's way too young. Our son had supplemental benefits before it was switched to survivors. He's 16 now and has autism. All right, so let's see. So he's receiving probably not disabled adult children benefits, and you were hopefully receiving um, child and care benefits, surviving child and care benefits. So your son was receiving is still receiving benefits, um, and he'll receive benefits until he's 18 years old or until he graduates high school, or 19 and 2 months, whichever comes sooner. But you can receive those child and care benefits. But there's an earnings limitation for you. Next year, it's what, $23,400. So if you're not working or earning under that, then you can collect what's called the child and care benefits. Not sure if you've already been receiving those, but those stop when your child is 16. Unless your child has been determined to be disabled before the age of 22. And autism, there's different spectrums. But so for you, I would definitely switch your child to a disabled adult child, get the disability determination done that he was disabled before the age of 22. And that opens up those child and care, surviving child and care benefits for you. And then you can get up to 75% of your husband's full benefit amount. So, yeah, make sure you get those benefits. I was widowed 3 years ago. I was found disabled last year. Would I be able to collect my husband's Social Security for the 5 months SSDI wait period? It depends on how old you are. If you're 60 years old, you can definitely file for those surviving spouse benefits. And even if, again, if you're disabled on your own record, then if those survivor benefits are more, then go ahead and collect those survivor benefits as well. Get those on top of your disabled. One offsets the other. But and then there's also another. I'm not sure how old you are. There's called disabled widows benefits. So if you're a disabled widow between the age of 50 and 59, you can get benefits from your deceased spouse's record, not your own. Your deceased spouse's benefits. How about if I get a pension? Can I get my spouse's Social Security? Yeah, if it's just a regular pension, no problems. If it's a pension from what's called a non-covered entity, that is a government, so local state government that did not pay into Social Security, then it offsets. But if it's not, then nope. Hit the like button, folks. It helps the site with views. Yes, please hit the like button and subscribe and send it to people and say, hey, have you watch this dude? And, might see if you can get any money and share and all that stuff. With IEDS, what level of the spouse's benefit would you receive, the fraud benefit? It's always calculated on the full retirement age benefit, but it depends on how old you are. If you file, if you get independently entitled divorce spouse benefits or divorce spouse benefits or uh, regular spouse benefits, if you start your benefits at 62, then your benefits are reduced by about 30%. So anytime you get money from Social Security early, it's almost always reduced. There are a few exceptions, but how do they judge SSDI if they go back 5 years? Most of that was I was out of work due to COVID closing Broadway, ending my trucking job. I only got $1,200 a month. Yeah, so there's two different statuses for being insured for disability. There is insured, that means you paid into Social Security for at least 10 years, 40 quarters, just regular, just like retirement or Medicare. That a little bit different if you're very young. And then there's also the currently insured. So you're probably talking about the currently insured. So you had to work 5 out of the last 10 years. It doesn't have to be consecutive or the last 5 years or the first 5 years or whatever. It's called the date last insured. So you can call Social Security and just ask them, hey, what's my DLI, my date last insured? And they'll tell you, again, you had to work 5 out of the last 10 years in order to be currently insured. So let's see. I've been on SSDI since an accident in 1985. I have a part-time job for 24 years, making less than a limit. I am wondering if I retire next year, will I still receive the same amount of SSDI? If you switch to regular retirement, your benefits are going to be reduced. So stay on SSDI until they switch you to full-time, retirement age retirement at that time. So just keep on keeping on. Will the X be notified if you file for spouse's benefits under their name? No, no. Sometimes if you file for just regular divorce spouse benefits, you were married to the person 10 years and all that kind of stuff. Sometimes when you file for independently entitled divorce spouse benefits, because the previous spouse hasn't filed yet, Social Security wants to contact that person to kind of check their earnings record and stuff like that. But sometimes, people say, no, I don't want that person to be contacted for whatever security reason or safety reason. Then you can just tell the Social Security employee says no, and they'll make other arrangement. They'll tell you what. Yeah. Dr. Ed, can I ask for a full audit of my account and explanation? They have changed my benefits multiple times without explanation. Yes. Fill in that SSA 561 and say, hey, I disagree. I think it's wrong, or whatever the case may be, and send me a full accounting, and they will do that. But that takes forever and a day. Your local office doesn't do that. They have to submit those to the regional office in your particular neck of the woods. There's 9 regional offices throughout the country, and those are the people that do it. Yep. All right. Let's see here. Referred by a friend. Oh, awesome. There we go. Considering medical supplement plan N, retiring 1224, is that your recommendation? Single, no dependent? Yes, that's where I say everybody should start. Why an N versus a G? Because I'm cheap like that. N is cheaper. The monthly premium is cheaper, and everybody believes, including myself, it's going to be cheaper going forward than a G. But G's are just easier to explain. That's why a lot of people push G's, because they're just so easy to explain. N just takes a little bit longer. So call it a chapter there. Yeah, if you're going to be retiring here this month, so you want to start your Part B January 1st, and your Part A, Part B first on January 1st, and then you also want all whatever else. If you get a Medicare supplement N or a G or whatever, or even a Medicare Advantage, you want all of those to start the same day, January 1st, February 1st, whenever, whichever one. So I would reach out to someone immediately, if not sooner, and so you can check all your options, so you're not, rushed. So if you don't know anybody that can help, reach out to Chapter, and they can help you out. They can review all the plans in your area and help you out. To be eligible for low income, you have to be living under a bridge. Yeah, that kind of seems like it nowadays, considering the rents out there. And particularly if you're out in the country or something, out in the desert, yeah, it's not too bad. But yeah, anywhere else. Um, Good to be alive and well. Yes. Every day above ground is a good day. Already answered that one. I have never found a person at Social Security offices that has any answers to my situation. Wow, that's not good. Remember, you can use any Social Security office you want. That's why my office was the third busiest in the country, because we got kind of the reputation of having pretty good customer service. Not perfect, not in any way, shape, or form, because we were so understaffed. The computer systems were so ancient. But anyway, but yeah, if you don't like your local Social Security office and you've got another one relatively close by, go to that other one. And when you talk to them, they will say, "This is not your office. Your zip code. You have to go to this other office." And then you say, "Doesn't it say Social Security Administration outside on the building?" Says, "Yeah." Says, "Well, then it is my office, because I can show you my checks for the last 40 years that I paid you guys." So every office in the country is my office. But yes, and also they recently changed the policy that the walk-ins, you have to have an appointment for all these things, which I 100% disagree with. I can see why they're doing it, because they're so understaffed. They're trying to control it. But if people would have thought about it for more than 15 seconds, they would see that having appointments slows everything down even more. So yeah, it's a bad idea to have appointments, if you ask me. We tried it in my office and it was a complete failure. I can get into that. So whoever is going to be, the new commissioner of Social Security, or efficiency experts, call me up and I'll tell you why that's a dumb idea. Lost Medicaid December 1st, not enough money after mortgage, oil, power. Is there a penalty for not having health insurance? Yes. But okay, so you lost Medicaid, and you probably also lost that Medicare savings program. So the Medicaid is no longer going to pay for your Part B premium. Because you lost your Medicaid, you have a special enrollment period. So reach out to your insurance broker agent, or reach out to Chapter there and tell them that you recently lost Medicaid. Because if you lost Medicaid, you probably also lost your Medicare Advantage dual eligible plan, and with all the extra benefits it had. So you have to switch to another plan. And maybe check out the Medicare Advantage Part B give back. If there's one available in your area, it pays for part of your Part B. But be careful with those. If you're relatively young, healthy-ish, um, and you don't go to the doctor a lot, those are pretty good. But these big health insurance companies don't get to be billion-dollar health insurance companies by being dumb. If they're going to give you $50, $100, $185 every month to pay for your Part B, they pay for it for you. Then they're going to take it out of other places. They're going to charge more for a hospital, an MRI, or drugs, or whatever the case may be. So yeah, definitely check those out. But kind of check out the details. What's best for you, and Chapter will help you with all that. Thank you. My son receives SSI autism, and I am applying for Social Security next January. All right. You mentioned he will have to be reevaluated. What shall I do now? Will this discontinue his SSI? No, it's just a bureaucratic thing. They need to determine when a child is receiving disability benefits, there's different criteria than an adult receiving disability benefits. So they'll just have to reevaluate it, confirm he was, disabled before the age of 22, based on adult criteria. So it's more of a bureaucratic thing than anything else, but it's still a nightmare. And if he's approved, remember, you've got those surviving child and care benefits. I think you're the same person that asked that. So can a divorced spouse of a disability person with 11 years collect and find kind of help? Ex-wife is 52 years old. No. Um, yeah, you have to be 62 years old to collect regular divorced spouse benefits, 60 to collect surviving spouse benefits. Um, yeah, unless you're taking care of a child of that person. If y'all had a child and that child is under the age of 18 or became disabled before the age of 22. Other than that, no. Um, is Medicare saving program depends on your total household income and your retirement savings, or anyone is eligible? No, yeah, because it's Medicaid. The Medicare savings program is tied to Medicaid, and each state does it a little bit different. Some states, they count this and not the other, and so I've had people that were receiving Medicaid and the Medicare savings program. They were in one state, they moved to another state, and now they lost it because that new state counts this and the other state didn't. So it really depends, yes. But as anything else, these government employees, state, local, federal, they are there to help you get your benefits. So if you think you're entitled to those benefits, then you call them up and they will make the determination. And if you disagree, then you file reconsideration, file an appeal. How does taxing work when one spouse is collecting Social Security and the other is still working? Do they affect each other? And is it a little more tricky the first year? Yeah. That sounds like, yeah, just regular tax. I don't do taxes. But if you're talking about the annual earnings limit, when you file for Social Security benefits early, you're, allowed next year 23,400. That's based on you. It's not family or household income. It's just your work. So let's see. I'm 53 and my husband just passed away, 63. I called for surviving spouse benefits and they told me I have to wait until I'm 60. What kind of benefits can I need to apply for? Yes, unfortunately. You have to wait till 60, unless you're disabled yourself, and then should definitely file for disability benefits on your own record. Why is it that if you remarry, you can't collect off of a former spouse of 20 plus years SSI? Well, you can't on SSI anyway, because SSI is a welfare-based program, but you mean regular Social Security, especially if it's a newer marriage and with someone who has years before reaching retirement age. Yeah, that's the way the law was written. If you're no longer dependent on your ex-spouse, you're dependent on your new spouse, and that's how they see it. My husband is 66 and was terminated from work on December 4th. He will have his health care until 12/30. They will pay for Cobra for 2 months. He is 66 and I'm 63. He just applied for Medicare Part B. So, yeah, he needs to if he just applied for Part B, if it starts December, January, then he has a couple 3 months to go ahead and find a plan. If he's got Cobra during that time, if they're paying for it, then he's got a couple of months as well. So I would definitely reach out and go over your options for Medicare insurance plan, a supplement, NG, a Medicare Advantage Part D plan, and all that kind of stuff. And again, Chapter can help you out. Reach them out, 100% free help. Um, but let's see. Other than that, yeah. And then in terms of you're 63, unfortunately, yeah, you're going to lose your health insurance from his employer. Sounds like you might have Cobra for a couple of months. So for you, unfortunately, the only thing you can do is get, the marketplace insurance, Affordable Care Act insurance for a couple of years until you reach 65 as well. So can you use those Cobra benefits? Yes. But um, once you lose your health insurance from current work, you have 8 months to sign up for Part B to avoid that penalty. Because if you don't sign up for Part B at the correct time, then you pay a 10% penalty for every 12 months you did not have that health insurance. Cobra does not count. So whenever you lose your health insurance from work, then you have 8 months. But I would definitely not wait 8 months, because you know what happens when you don't have health insurance for 8 months then. But sounds like you do for a couple of months. So you've got a little bit of wiggle room there. Um, Thank you so much for sharing the Social Security information. You're welcome. And big thanks for your military service. Spoke with Sarah at Chapter. Very helpful and professional. Awesome. Awesome. Yeah, unfortunately, there's a lot of people that couldn't get through, and because this was the craziest Medicare season we've had since probably the whole thing started a couple of decades ago, in terms of Medicare supplements and Advantage and all that kind of stuff because of all the changes for next year. So, if you weren't able to get in, or if you got into some other place and you're want a second opinion, you can reach out to Chapter, and as of starting tomorrow, because all the 2025 plans are still available and they can look at the plans. They can't switch you until January 1st, but you can at least check out what your options are and see if you are still in the best plan. And if there's a better plan for 2025, they'll talk about it, and then they'll recontact you again January 1st to actually push the button, and then your new plan will start February 1st. And remember, if you're new to Medicare Part B, you just lost your, health insurance from work, or you're turning 65, that whole December 7th and January and March 31st, and all that stuff, no relevance to you. Yep, you can do it. I'm alarmed. Senator Marsha Blackburn announced she will introduce bills to facilitate DOGE. The bills would allow each cabinet secretary to reform federal agencies how best they see fit. Yeah, this is a long-term plan. If you look into the description down below, I put the long-term plan. There's a plan that people that want to, cut and destroy Social Security and give it over to Wall Street. They've had this plan for a couple of decades, and they wrote it out. And I've got it in the description, and you just read it, and it says exactly what they're going to do. They're going to create a crisis, and they're going to distract about this, stolen and given to illegals and given to Ukraine. And these are all distractions, and we keep falling for it. And then they kick the can down the road, and they sit there and they wait for a crisis, or they help the crisis. They don't, render help to Social Security or us. And then when the crisis happens and they have completely, destroyed our faith in the system, then they will say, hey, we tried nothing and we're all out of ideas. So it's time to just go ahead and give it over to Wall Street, or cut it, or, get rid of it, or kill it, or drown it in the bathtub, as they used to say. I'm 53, husband, but we're smarter than that. We're going to stop him, right? Okay. Husband on disability passed. Our son, 16, has supplemental income, was changed to survivors. Okay, we already talked to them. Already answered that one. Um, my retirement benefits will be reinstated after 20 months suspension. I returned to work, help out, earned too much. Will the COLAs that I missed be added into the calculation? Yes. Yep, that's automatic. As soon as the COLA comes out for every year, then the computer system automatically goes in there and multiplies, 70 million records by 2.5%. Pretty terrible for next year. Can my husband apply for deemed benefit? He is 64 and a half, so can he collect his own and from mine totaling more? I am 57 on SSDI. Yeah, yes, he has to file for benefits on his own record, and he is at least 62 years old. So if there's more money on your record, twice as much, then yeah, he can collect the difference between the two. Absolutely. The easiest way to do it, because again, you don't look at your benefit check to determine if one is twice the others, because that's what's called your MBA, your monthly benefit amount. You need to look at your PIA, the primary insurance amount, which is the amount you would receive at your full retirement age. So you need to compare those numbers. And but I don't know my PIA. Easy. Call the 800. Well, not easy. You have to be on a hold for 3 hours because your local politician doesn't want to support your local office. Anyway, so you call them up and say, you and your husband, or you and your wife, get on the phone there and say, hey, can I get any more money from this person? And they'll check your PIA and the other person's PIA, and they'll say yes or no. And then you can go on with your life or take a claim and get some more money. Ed, I enrolled in a Medicare Advantage plan for 2025, but I changed my mind. Can I disenroll now, or do I have to wait until after January 1st? Thanks for what you are doing. You're a god. Yes, no, you have to wait till January 1st, but to push the button to submit the application, you cannot submit the application until January 1st, but you can start figuring out what plan you should have joined right now. Well, Not today, because if you're going to use Medicare or if you're going to use chapter, all those guys are sleeping for 24 hours. They're in hibernation because they've been working, 20 hours a day, it seems like, since October 1st. So starting tomorrow, give them a call tomorrow and say, hey, oops, I should have chose another plan. And they can check all the plans, and then they can check your doctors and prescriptions and see what kind of dental you need, or, whatever the case may be. And then when they say, okay, well, this is the best plan for you. What do you think? Is this the best plan? You like this plan? Okay. Then they'll send you all the stuff, and then you can't push the button until January 1st. And then that new plan will take effect February 1st. All right, let's see. Let me jump around. We're getting close to the end here. Find some people that I don't recognize, get some new people. Kathy, I get SSDI and divorced widow benefits 2 years before I can get Medicare. I can't get Medicaid now. I'm paying $500 a month, 60-year old. Any suggestions? Yeah, yeah. In order to get Medicare for being on SSDI, you have to wait 2 years. So, as I've said many times on this channel, that's one of the things I would definitely change. If as soon as you start your disability insurance, because come on, when you're on disability, you kind of need health care, right? Immediately. So when you're on disability, if I was dictator for a day, right after the cure for male pattern baldness, I would do several other things. Sorry, I have my priorities. I would do SSDI. As soon as you're approved, as soon as you get your first check, you should be eligible for Medicare. If you're filing for early retirement at 62, you should get your Medicare, immediately. And we shouldn't need Medicare Advantage or Medicare supplements. All the gaps of original Medicare that we paid for decades and should be covered. Part A and Part B, and the drugs should be covered as so we shouldn't need private insurance. But unfortunately, I am not dictator, and so we have to deal with what we do. So we work the best we possibly can. So, okay, all right. Let me. Hey, Take and Took. What's up? Imaginator and Take and Took are always awesome out there. Yeah, Wanda, I'm still working on that petition, Wanda. I think I've got it nailed down. I'm 66 and have to wait 10 months for full retirement. Can I make as much as I want? Um, if you're currently receiving benefits, then yeah, this year you had to be about 22. Next year you have to stay under the 23,400. But wait 10 months. Okay, so your full retirement age is next year, 2025. So basically, next year you can make the numbers for next year is $62,160. So you can make $62,160 in the first 9 months, because starting the 10th month, I guess October, you can go back to making $1 billion a month, and it doesn't affect your Social Security check negatively at all. So, Charles at Chapter hooked me up with a good Gold Plus plan I am happy with. Awesome. Good deal. Good deal. Awesome. Glad to hear it. I'm 53. Okay, I already answered that one. In the past, you mentioned to get your DQI when applying for Social Security. I see how now, effective October 2024, Social Security will be charging for this information. Yeah, they've been charging for DQIs forever. Yeah, they've always been charging for that, if it's not program related. And they really need to change the policy to make this more clear for us and Social Security employees. When you file for your Social Security benefits, um, you know, when I took the hundreds of thousands of retirement claims I took when I was working at Social Security, and it was in office, we used to print off the DQI and say, hey, here's your detailed earnings query of all the money you paid into Social Security all those decades. How's it look? Does it look correct? And then you would have it. And because that's to check to see if Social Security records are correct, right? So that is program related. They should give you that for free. They better give you that for free. But here's what the Social Security has been charging for decades is, if you are getting it, what happens is people that are applying for like metro jobs, metro police department, they need a background check. And in order to get that background check, part of that background check is to get their work history for the past 10 years. So they go down to the local Social Security office and get that work history. And Social Security one day said, hey, we're doing this a lot. And it's costing us time and money to, staff to do this. And this is not really program related. This is just, someone needs a background check type thing. So they started charging for that, like over $100. It's pretty expensive, $100 for 2 pieces of paper. It's crazy. But yeah, they really shouldn't. If it's program related, if you're filing for benefits, they should. And if you see a discrepancy in your SEQI, which is the summary, the simple one, then you can say, okay, hey, in 1984 it shows, 0, but I worked in 1984. And then you say, hey, I want the DQI for 1984 to show the detail, or 1983 and 1985 to show, what companies I was working with around that particular time. So yeah, Social Security. I don't know if they changed anything or they just increased the price, which they do all the time. But yeah, that's people are being charged when they shouldn't be. So if Social Security were to end, would I at least get back the money I have paid in? Yeah, well, we haven't come, I did a video yesterday when I talked about Chicken Little, the worst enemy of Social Security. One of the worst enemies of Social Security is Social Security itself, the chief actuary of Social Security who does all the calculations for the future and everything. And his job, or his or her job, is to do those calculations based on 75 years in the future. Could you imagine any company on Wall Street, projecting 75 years in the future? Apple, IBM, or any company, Facebook or something, they would all say, well, we might be here, we might not. And so because Social Security has to project 75 years in the future, then based on demographics and everything, there's always going to be a shortfall possibly. And so that's what happens. So that's why we get this kind of, Social Security crisis fatigue. And Social Security, the politicians take advantage of that fatigue and build up that fear and for their own purposes. And yeah, so anyway, but I did a video on that yesterday. Check it out. Can Social Security programs be shut off? Okay, I already answered that one. Okay. Does interest earned from my 401k deposit brokerage regarded as income? No. How about when one withdraws the money from 401k? No, that's not considered income for Social Security or retirement benefits, spouse benefits, survivor benefits, SSDI. But if you have Medicare, that might increase your Part B premium 2 years after you take those withdrawals. So I'm here watching and listening, and I'm learning so much. Thank you for always sharing your knowledge, and I appreciate all of your hard work. Yeah, I appreciate it. Now I ask you to share as well. Subscribe, like, share, and all that kind of good stuff. So, if the government thinks you have ripped them off, they will come calling. Yeah, the overpayments, that was a big thing recently. Yeah. Anyway, I'm on SSDI and receive a Teamster's pension. Should I be worried? Um, you should contact your politician and thank you for being a Teamster. My father was a Teamster for like 50 years, drove a 18-wheeler. So yeah, that Teamster pension definitely come in. He had to battle for that a little bit too. So I am on SSDI and recently I turned 65. My question is, does my SSDI change to regular Social Security at 65 or full benefit at 66 and 11 months? It's the full benefit amount. But if you just turned 65 and you're on SSDI, I would check out your Medicare plan one more time, because in most states, if you're on SSDI under 65 years old, pretty much all you can get is a Medicare Advantage plan, and you can't get a Medicare Supplement plan. But now that you're 65, you can get a Medicare Supplement plan. They cannot deny you, they cannot ask you health questions, they cannot charge you more. So now that you're 65, you're in that golden opportunity. So I would reach out, call chapter there and say, hey, since I'm 65 and I'm only get to basically this one chance, how much is a plan N and a plan G, and what would it cover? Why should I have that versus what I currently have? At least, check it out. So, all right, let's see. So let me get a couple of more questions and then we'll call it a day. Thanks to you, I get ex survivor benefits, retro 2 years because prior inquiry. Oh, can Social Security? Oh, look at that. Well, again, not thanks to me. It's thanks to the Imaginator and Take and Took and Penelope and all the other hundreds of thousands of people that press like and subscribe. That's how you got this information. It's, but thank you. Thanks to awesome community we have here. Can Social Security also backdate on X record and save my record? Concern Social Security cut survivor benefits. Need delayed draw mine to 70. Um, yeah, I'm not sure so you got the survivor benefits. Oh, okay. So you file for benefits on your own record, but you were probably given incorrect information. They should have had you do survivor benefits. And now they corrected that and they say, yeah, yeah, okay, we should have talked to you about this other thing. We didn't. So we're going to go ahead and start your survivor benefits 2 years back. But yeah, I would definitely try it. Do the SSA 561 and say, thank you for starting my survivor benefits, but you forgot the next part of the puzzle was, hey, you know, I shouldn't have started benefits on my own record 2 years ago. I should have always been receiving survivor benefits, and therefore you should stop my retirement benefits so it can increase till I'm 70 years old. Yes, Gia, absolutely. Try that. Yes. And come back here and tell it it's going to be a nightmare. They're going to have to do some deep calculations because one's going to offset the other, and they're basically going to pay it back, but they're already paying it back on your survivors. So, but that's you don't have to worry about that. That's their own issue that they have to deal with. They have to do what's called an A101 or an E101. It's a manual action, but um, yes, good on you that you thought about that. Absolutely. Yes, SSA 561 and put it in there. And on the SSA 561, there's only like a 2 or 3 lines to write, what you're asking for them to reconsider. So just type on another piece of paper, and then on the 561 on the front page is put "see attached," and then submit it to Social Security. Make sure you make a copy. Make sure when you give it to them, they stamp it and initial it that they got a copy. And then unfortunately, you just wait and wait and wait and wait, and hopefully they do what you want. And yeah, then you wait till 70 and get your extra benefits. Awesome, awesome, good, good, good. I like it. All right. Unfortunately, we're out of time. I will be back again tomorrow there. So cut and paste your question, and please join me tomorrow, and I'll get to as many questions as I can tomorrow as well.